Permit me to provide a bit of a background for this opening session. We've termed this a tea conversation to allow us to have some interaction and set the stage for the conversations we'll be having over the next 2 days. In this session, we will largely be looking at reflections on the Agenda 2063 and the role of young people, particularly those in thematic fields like health, and how that also, within the purview of the issues of Africa Health Strategy 2016 to 2030 and the Africa CDC's new public health order. The conversation this morning will try to elicit from our panelists, the ministers, their views on why it is important to center the role of young people in achieving the goals of a safer and healthier Africa. We encourage you to also engage with that conversation in your own spaces, on your own platforms, and we would also have opportunity over the next 2 days to interrogate all these issues in the other various sessions. This will be the opening session, and it will be followed by an intergenerational dialogue where we'll be reflecting on envisioning an inclusive public health future in Africa and the new public health order, the role of young people in that. Later this afternoon, we would have what we call TEDx-style talks, featuring colleagues who work in health tech and issues relating to climate change and Africa's health security. And then later in the afternoon, we will begin to go into individual groups to reflect a lot more on issues that relate to the role of young people in public health policy, public health research, community engagement, technology and innovation, public health workforce, education and capacity development, planning and health economics. As we await signal, we would kick off the conversation on the stage so we don't keep the excellencies. We know they have very busy schedule. And I would like to invite His Excellency Honorable Dr. Sabin Nsanzimana, our host, the Minister of Health for the Republic of Rwanda, to please kick us off with his remarks. Your Excellency, you have the floor.
Good morning. Can you hear me? Mwaramutse. Bonjour. Honorable Minister, distinguished co-chairs of this conference on public health in Africa 2022, who are joining us remotely. Dear leaders, youth, colleagues, friends, partners, researchers, community representatives, media, good morning again. So as the Ministry of Health, we are very pleased to welcome you to this conference, actually pre-conference. And we are very glad that we start with the youth, because the youth is the present and the youth is the future. And as has been noted from the beginning, we are together as Africa, as young Africans, to rethink on how we can build a stronger health systems in Africa that are ready, resilient, vibrant, innovative, to face the challenges we are having in our countries, and even beyond, and be able to provide solutions to our continent, also to our world, because at the end, we are one. We are one family, we are one community, and it's no better group to make the change and improvements in what we see today as challenges and lessons learned than youth. We are very pleased to have here together with us the Minister of Youth, who is also an advocate of the transformation of the lives of people and future of our nations using the power of young people, of the youth. Thank you again, Minister, for joining us. For those who traveled from long distance to come to Kigali, it's also an opportunity to welcome you to the beautiful, clean, safe, and smart city of Kigali. I hope you've already noticed that. So enjoy Kigali, but also enjoy the conversations, the discussions that we count on you for the changes that are expected in our public health. And public health is not for doctors. It's not for nurses. It's not for lab scientists. It's not for epidemiologists. Public health is for the people, for you, for us, for everyone who is not here. Yesterday I was talking with some media people asking, what's the definition of public health? It's actually very hard to define public health because it's so wide and comprehensive. It goes from preventive to treatment, to follow-up, surveillance, to nutrition, to well-being. So at the end, it's every single day of our life. As far as public health is improved, the life of people is improved, the nation improved, and the economy is also improved. So this pandemic we are going through, at least the past 3 years, has demonstrated how we need to invest and strengthen our health systems and our public health in general. And Africa CDC has been a key player on our continent to advocate and to demonstrate how, as a continent, we've been facing a lot of challenges in COVID-19 from day one, when we were asked to be at the last line for access to basic health tools, even protective equipments. When vaccine came, it was even more complicated because we don't produce vaccine on our continent, at least by that time, very little, but we consume more than vaccines produced worldwide. From scientific perspective, disease burden, more than 50% of disease burden worldwide are here on our continent. More than half, if you look at HIV, malaria, TB, at least infectious, but also non-communicable diseases. But if you look at how we contribute to solutions to this issue that we are facing as a continent, it is only 1 to 2% scientific output contributions from Africa to the world. So we have the biggest problem than any other continent in the world in terms of disease burden, but our contribution to solve those problems is only 2%, 1 to 2% research output to solve health problems. So always mention this because it's the biggest mismatch I've ever seen in my career that we must address as fast as possible and as urgent as possible. It doesn't need to come from overseas. It has to come from us, from you, the young people, from universities, from medical, from non-medical schools, from experts, that at least the past we cannot go back and change what we lost in terms of science, in terms of public health investment, but at least the future and the present, we have control of that. So this conference is another moment to reflect on that, but not just reflecting, but make clear plans and goals, not just goals, but also make actions, innovations that are going to solve these problems. We don't need to think about big projects, big investment that will take us 10 years or more. Think about small actions that may make big changes at your school, at your institutions, in your community, where you traveled from, in your village. Do something different to improve the health of the people that are around you. If we all make small changes, small innovations, if you put all those together, you will see a big change in our health system in Africa. We move from 1 to 2% to 50, even to 100%, because we must solve our problems 100%. So without that, we will see generations that will face the same challenges that we are facing, or others will face our children and our grandchildren. Do you accept that? Do you accept that we have problems, but we don't contribute to solutions? No. We must solve our problems. And these are not impossible, because others have done that. There are easy things we can start by doing, just coming together, like this. Early morning, the minister was saying, oh, it's good to have young people early morning discussing about problems and solutions. So congratulations, first step, you've already made it. That you came and don't just come to take selfies and pictures and post that. That is okay, but it's not enough. It's not going to solve Africa's health problems. Go and make projects, actions, measure that, see how we're improving. This is why we're here. This is why you represent so many thousands of people who applied to come. But you only made it. So bring that message and make the change, be progressive, and most importantly, be consistent, be disciplined. Now I'm talking like a teacher because I see most of my students sitting, some of them are here. So it's an opportunity to remind you that we expect a lot from you now and in the future. So again, welcome to Rwanda. It's a very important honor to have you, but also because you are warming up, you are helping us to warm up for the conference to begin in the next few days. And when you warm up with young people, it's always cool, interesting, happy, but it has to be productive. Thank you so much. Murakoze cyane. Have a great day and a great conference.
Thank you very much, Your Excellency. Very important words on the role of young people, the need for collective action, and the need to work for the youth of today, but also the youth of tomorrow in a more safer and healthier environment. Thank you very much, Your Excellency. At this point, we would take the remarks of Dr. Ahmed Ogwell Uma. Technical, please.
Our program, we have 9 tracks that are focusing on different areas across public health, including high consequence infectious diseases, local vaccine manufacturing, which the minister alluded to, health system strengthening, women in health. So for all the women in the room, there is a specific track for us to discuss how do we get women ahead? How do we create opportunities for young women? We have a track on our response to COVID, which is ongoing. We have many lessons learned. We have a track on digital health, which is extremely important in the world that we live in. We have a track on the whole of society, and this includes youth engagement and community engagement, as well as infectious diseases and non-communicable diseases. So there are many sessions that are very relevant to you and to colleagues who are not attending. So I think maybe I can stop there, and I can take any questions as we go.
Thank you very much, Shingai. And that's very important because for all of you who have been invited to participate in the pre-conference, you also got yourself registered and participating in the main conference. So put your hands together for the Africa CDC. This is what we want. that young people are not given a special space to only discuss their issues, but they are also part and parcel of the broader conversations at the main event. So we really thank you, Shingai Machingaze, the Senior Science Officer at Africa CDC, for the role that you have played in facilitating this. So colleagues, I invite you once again to put our hands together for our colleagues. Thank you very much. Let me invite my colleague, Nicole Jabo, to also share with us from the Ministry of Health here in Rwanda, the preparations that have been made for young people who will be taking part in this conference. From the Rwandan perspective, please take the floor. Thank you very much.
Thank you so much. Good morning, everybody, honorable ministers. Very honored to also be part of this panel to discuss our preparations for the main conference in general. So as my colleague mentioned, there are very pertinent tracks that are relevant to each and every one of us in this room. And once again, just to express my congratulations to everybody also that made it this far towards this conference. So regarding preparations, I'll just touch on logistics. We are ready to host all of you. There are very interesting side events that are starting on December 12th. And all of the events are going to be taking place at the Kigali Convention Center. There will be a lot of support staff to guide you and help to make sure that really you're in all the rooms that you need to be and are taking part and being an active part of the engagements that are taking place. So once you're on the ground, there will be testing just to prepare you for us to have a safe health conference. And there's different hallways that you'll see at the Kigali Convention Center where there's different sessions going on. So we welcome you to really take part and engage in all the lineup of events. As Shingai mentioned, there are different tracks, and you can also accustom yourself with specific ones that you would like to join using the website. Otherwise, mine are just to say we are ready for you. We have support contact information on the ground as well for any help that you may need while on the ground. So we look forward to hosting you. Thank you.
Thank you very much, Nicole. We can do better than that. I'm sure we had breakfast, didn't we? So let's put those hands together. Those hands, put them together for the Republic of Rwanda. Thank you. Thank you very much as you do that. Thank you very much. As you have been told, over the next, for some people, 6 days, you have a full agenda, not just with the Youth Pre-Conference, but also at the main conference. Later today, as I mentioned earlier, we would have breakout sessions. Links will be shared with you to also select the sessions that you will be joining and having broader conversations on the themes, on the sub-themes that we have identified for you. Those conversations would be put together, your recommendations and conclusions of your conversations later today will be put together in a document that will form part and parcel of the outcomes of the Conference on Public Health in Africa 2022. So this is a serious conversation. I'd like to apologize for the technical issues that we're having. All of that will be sorted by the time you go for your tea break and return. Back to the show. Ladies and gentlemen, shall we put our hands together as I welcome the Honorable Minister for Youth and Culture, the Republic of Rwanda, Honorable Rosemary Mbabazi, for our input. Honorable, please, you can take the podium. Thank you.
It's very early in the morning. I just want to try and see if I can stretch. Thank you very much, a great moderator. He tried to manage the challenges of connectivity and I think the technical issues. We also apologize. We believe he's going to be sorted out. Can we give him a round of applause for the good job he's doing? I also want to thank you very much. I thought you must be still sleeping. And I was so very impressed when I found the whole room. You're all here waiting. So give yourselves a round of applause for doing this. This is great. It's very symbolic. what Dr. Sabe was talking about is going to be implemented because there is a will that we see in you. Give yourself another round of applause for that. Thank you very much. Honorable Minister of Health, Dr. Sabe Nsanzimana, the Minister of Health for the Republic of Rwanda, the representative of CDC present here, the team organizing this great event, the representative from the African Union Commission, and also the delegates, the United Nations agencies representatives, development partners present, the young people. Good morning.
Good morning.
I just want to hear if you had breakfast. Good morning.
Good morning.
You're doing better now. Thank you very much for inviting us, the CDC and organizers and the Ministry of Health, for inviting young people for this important forum. This is wonderful. We don't have just speak, but we have to do what we always talk about, walk the talk. As we always say, a health nation is a wealth nation. Africa is a continent known for diseases, like they mentioned earlier, poverty, wars and conflict, hunger, and yet, on the other side, we always talk about the enormous numbers of the young people that we have on the continent. Our contribution to what the doctor was talking about, our contribution in research output is also very minimal, yet we are the continent with all these problems that we talk about. I think having the young people at this forum, adding what our colleague mentioned from CDC, is very strategic, and we welcome that as the government of Rwanda, because we have already taken a bold decision to engage young people in every decision that we take as a country. This is in alignment with the policy that we have, mainstreaming young people in health system and health sector, in agriculture production, if you want food production, and also end hunger, in technology innovations, for having young people to innovate what is relevant for the communities and solving the problems of the community, in climate change, name but a few. So this is very well welcome, because we've been having a lot of events and discussions on different sectors, and young people has been at the forefront, especially having discussions before the main conference so that they can take their recommendations into the main event. So this is very much welcome, and I believe it's going to be continuous going forward. Aren't you glad about that? But as they mentioned earlier, and also I mentioned, it's very strategic, very proactive, and very deliberate to engage young people, because they're the current and the future of our continent. So having you here on board is not only to participate, it's not only to listen to discussions, but also to keenly find out what are we going to do post the event. That's the most important part of it. We want to hear innovations within your communities. We want to hear the decisions that you want to see taking place, because all the decisions we take as leaders is for the benefits of the community, is the benefit for our people. And as we always say, the young people are the strong foundation for any country. The likewise, health sector is the foundation for our survival. If we want a very secure, resilient, prosperous country, and also prosperous continent, as we always say, the 2063, we cannot have this until we tackle the issue that deals with our health, the first of all these problems to solve. And I was so glad that he was a very energetic young man, and he had a team of energetic young people that were supporting him. And I have seen the will of young people from Rwanda in particular. That's the only country I can speak on behalf, because I haven't been to other places to see how you handled it, but we saw the young people in Rwanda coming out very strongly, not waiting for health practitioners, but only even the young people within the community, the youth volunteers, that were helping to give us more information about COVID pandemic, how it can be spread, how we can prevent it, how we can help ourselves within the community to be resilient and survive. And they came out very strongly to help the community. And we contribute also, we think they contributed substantially to the reduction of this pandemic spread within our community. And these were students, health students who are in the universities, who are helping in the vaccination, who are doing the testing within the communities, to the agriculture economists and others, who the scientists, everyone was contributing something irrespective of what field they were coming from. They came together to give all the measures about COVID, to help the community revive and recover, to protect us all that we are safe. Some of them even had the COVID, contracted COVID, but they recovered. And so that is the kind of the spirit that you want to see in the young people, not being spectators within your continent, not being spectators and observers. You are not observers. You are very important people in the community that are having to support everything that is being done in the interest of our community. So we have seen this in Rwanda, and I think it can happen anywhere else, especially our history. This pandemic weakened the situations of our health systems, of course, but also it was an opportunity to strengthen it further so that we can even solve the problem at hand, but also strategize for the future similar events that we don't wish to have. As we continue to recover from the consequences of the pandemic, reimagine our economic recovery and build back stronger, as we always say, we want to come out stronger and more resilient. I don't want to say much, but just want to hear from you, what are we going to do post this event? Because the leaders have given you the platform, the leaders want to hear from you, and it's not even leaders, you are leaders. You don't have to wait until you're a minister, until you're a director, until you're a researcher, or professional in this field. Wherever you are in your community, you can drive change. And leadership is an attitude. Leadership is not a position that you hold. If you don't have a right attitude, even if you're given the position, you cannot do anything until you have the attitude to change things. The attitude that is pro-people. The attitude that want to change the status quo. The image of Africa, a disease continent, a disease of frustrations, and yet we have all the resources on the continent that can enable us to prosper and instead make other continents survive. Yes, other continents survive on us, survive on the resources that we have, and survive because we exist. And so I think we can do much more, especially you young people that have more knowledge than our parents, that has more skills than the previous generations, that has more exposure than previous generations, that has more technology. I was talking to some young people yesterday, and I was recalling 20, 25 years ago, you could travel from one place to another, and you didn't have any connection on telephone. You had no way, just tell you, go, you find a tree, maybe a mango tree, you stop there, someone else will come and pick it. Look at that journey. You go and find someone with a folded shirt, you know, that's the person that is going to direct you to the next place. But for you, it's just a click on the phone, and everything is available. So I believe with all these opportunities that you have, you're capable, and the whole continent trusts that you're capable and you're able to do much more, because those who are given more, we expect a lot from them. So you're given all these platforms to do much more, and always feel, when you leave this place, feel restless. And as you sleep, like you woke up very early in the morning coming here, go back thinking about what can I do better? What is not doing well in the community? Not just go and fight with the community, but find solutions to make the community more harmonious and provide the solution that you find. Don't look for bigger projects like they mentioned earlier that are so huge for you. Start small with a big vision, and you're capable of achieving that. The good projects that you might have, as small as it is, it will attract positive energy from other like-minded partners that are going to support you in the projects that you're doing. Start with the community health workers that are in the community that help creating awareness. We have many problems, like she mentioned, about especially young women, teenage pregnancies, drug abuse within the communities for the youth, also about malaria, TB, and HIV that is also rising again, especially among young people. All these are issues within our means. And I was so glad that they demystified to show there are things that we can do within our means without waiting to be a really professional. But also taking professional courses for that matter and getting more informed is also very good, that you cannot shy away from it, especially that is very possible with technology advancement that we have. So you have all this in your hands, within your means, and as leaders, we are here to support you, and really be glad if you move on the ladder. If you don't make it, go back and rethink about it. If you fail this, don't give up. keep trying. But most importantly, let's have the heart for our continent. Let's be present for the decisions and every aspect that we do for our continent. Most importantly as well is to have discipline. Dr. Sabe mentioned about that. Discipline, discipline, discipline is very important. It starts with the decision to wake up very early. And while you're trying to wake up early, you say, let me wake up another hour. Let me extend 1 hour. That's not discipline. Then you say, I'm not going to wake up. Let me change it. And you change the whole program because you are not disciplined. You say, I'm going to stop partying on Monday. Going out to do partying on Monday. Because you are partying on the whole weekend and you want to extend to Monday, to Tuesday. They will chase you out of work. That is discipline. Even if you are so skilled, even if you are so knowledgeable, without discipline, you cannot accommodate this world. You cannot make changes that we need. You cannot be transformational. So I don't want to say much because when I speak to the young people, I can go on and on, but I know you also have a lot of ideas to teach us. I want to thank you very much and welcome you once again, and looking forward to hear the great innovations and actions you're going to do within your communities. Thank you very much. Merci beaucoup. Asanteni.
Thank you very much. I think we can do a lot better than that. I was waiting for the, what's going on? This is a youth event. No, but thank you very much, Honorable Minister. I mean, and I'm glad that you reminded us that this is one of the most educated, if not the most educated, most connected generation ever. And we have an opportunity. I have an anecdote I always say that in the 60s and the 70s, when there was no, even the flight connections from one country to the other was very difficult. There was no internet. Pan-African leaders were connecting themselves far more than we're doing today. They knew themselves. They were collaborating a lot more. Many of us who are in Nigeria read a lot about Kenneth Kaunda in his book. Many people from several countries know a lot about Chinua Achebe. Things fall apart. But today, I'm not sure that many of us can tell you who are the writers in Rwanda, in South Africa, in DRC Congo. We have to do a lot more. And this is why platforms like these have been put together, to create an opportunity for us beyond what we do online, to also form very important relationships, transformational ones, those that help us address the challenges that we face as a continent. Honorable Minister, as you said, we've brought in this room people who are already doing, but they have to do more. The challenge we have is scale. And I'm glad that in your speech, you pointed that clearly to us. So thank you very much for your input. We really, really appreciate it. For this opening session, we will try to bring it to a close now. Dr. Ahmed Umar will be speaking to us much later today when we sort out the technical issues. And we will take just a few minutes break for about 10 minutes to prepare for the next session. And we implore those of you who have not registered in that time to please do your registrations. And if you have that time, to also interact with the people sitting next to you and all of that. And we do that in 10 minutes. And we'll start the next session at 10:20. I hope that is fine. As I bring this panel to a close, I want you to please give a warm round of applause again to Honorable Minister Dr. Sabin Nsanzimana, Honorable Rosemary. Thank you very much, Mbabazi. My dear colleague, Ms. Shingai Machingaze, Nicole, thank you very much for this session. And we would now close the session and we meet in another 10 minutes. Thank you very much.